Welcome, everyone. This is Andrew Rosen at Diversified on behalf of myself, David Levy, and Kyle Hill. I'd like to appreciate everyone that's able to make it into our webinar series. We will be having our next one June 13th at noon. That is the essential estate planning documents that everyone needs. Couple housekeeping items for everyone. If anyone's having any technical difficulty hearing or seeing the screen, please call our office, as Kelly, Ashley, or someone here will help assist and get you up and running. We will be sharing this content by email after the fact. Also, Nick, who is our guest speaker today, who I'll give an intro to it momentarily, will be able to answer questions at the end. We've left about 20 minutes, or he's speaking for about 20 minutes. We left about 10 minutes at the end for him to answer any questions, assuming we have time. We'll answer them in a first come, first served basis. The way we will answer them is please write in the questions column box on the web meeting service. Send your question, we'll get it, we'll ask on your behalf. Of course, if we run out of time, we're happy to get you answers after the fact. So thank you again for everyone that's listening. Let me give a little introduction to our good friend, Nick Moriello. He's done this for us a couple times in the past and been really well received. He is currently the Vice President of Consumer, Medicare, and Government Affairs at Savoy, which is an innovative benefits consulting firm and general agency focused on helping their business partners, including insurance brokers, carriers, and vendors, to achieve their business goals. With 24 years of health care experience, his technical expertise, and his ability to convey complex insurance topics in every language draw agents and clients to him at Savoy. And as you'll find, he's very knowledgeable, and we're excited to have him. Thank you, Nick. We will turn it over to you.
Thank you so much. I'm happy to do this today. So I'll jump right in, given we've got some limited time here. Thought we'd put together a program with some updated numbers for those of you who may have attended one of our presentations in the past that's geared towards health insurance for those of you who may be retired or thinking about retirement or planning for retirement. In terms of who we are, you'll see on the slides Acela. Acela is a company related to Savoy. So you heard in my title, I work at a company called Savoy. We have a partner company called Acela, and Acela faces consumers and individuals and employers throughout Delaware, Pennsylvania, Maryland, New Jersey, and New York. And so we're more than happy to help should you need us. And we do all things related to health insurance. So, thinking about health care and health insurance into retirement, we find that there are common questions that our clients generally ask us, and the questions can be a little different if folks are retiring before reaching the age of 65 or retiring after the age of 65. 65 is that magic age when you become eligible for Medicare if you haven't already become eligible for Medicare due to a disability. So common questions. Everyone wants to know if I'm going to have enough money. Am I going to have enough money to be able to retire? And you need money for lots of different living expenses, but health care and health insurance is certainly a large portion of that. So regardless of whether you're retiring pre or post 65, will you have enough money is certainly a big question. Folks ask us, should they continue to work part-time? Some employers do continue to offer health benefits to part-time employees, and so that becomes a consideration. But what we're finding is fewer and fewer employers in this region of the country are continuing to offer health care benefits to part-time employees. Folks ask us, well, how do I budget for Medicare? Even if I'm retiring before 65, I'm going to reach Medicare at age 65, and how much do I need to budget for it? Is Medicare by itself enough? Questions along those lines. And then folks ask us about their employer perks. for those of you who might be covered through an employer, you might have additional insurance-related benefits. Most common examples would be dental insurance and vision insurance, gym memberships, programs that help to quit smoking, or programs to manage weight. So those are some things that typically go away when the employer plan ends. And then for those folks who are not yet of Medicare age, the big question is, how much is it going to cost? How do I go about getting it, and how much is it going to cost? So those are just some of the most common questions that we help folks go through. So now what I thought would be helpful is if we talked about just some dollars and cents. So what are average costs of an employer health plan versus the average cost to obtain personal policies? And so I want to focus first on personal policies that are pre-age 65. So I'm going to use an example of a 60-year-old client who comes to us. So they're not yet of Medicare age, they're not disabled, but they've worked with the team at Diversified, and they've planned for retirement, and you're ready to retire at, let's say, 60, just as an example. And they come to us to purchase health insurance. This is assuming that the employer does not offer a retiree health plan, which is another thing that fewer and fewer employers have continued to do. In fact, some major employers in our vicinity right here have dramatically altered what they do for retirees in recent years. So, average cost. A 60-year-old person in Delaware comes to us to purchase a personal health insurance plan. What would that cost right now today in 2018? And the average monthly premium is just over $1,000 for a single individual at age 60. So the price has become exorbitant in recent years. Moving from 2016 into 2017, prices went up by roughly 35% here in Delaware. And then from 2017 into 2018, they went up roughly an additional 25%. We don't expect the increase to be that dramatic going into 2019, but we're already talking about pretty big numbers if we use that $1,000 premium as an example. That's a monthly premium for somebody 60-year-old here in Delaware. If we were comparing that to the average cost that an employer pays here in Delaware, and I'm going to use large employers as examples, AstraZeneca, Dow DuPont, Bank of America, ChristianaCare as examples. Average cost of a plan for an employee at a company of that size is just under $500 a month. When you purchase on your own, pricing is based on age. And so at the closer we become to age 65, the more expensive it becomes. So again, using that 60-year-old person example, at an employer, the full cost is $500 a month, and the employer is paying a large portion of that. When you go out onto your own, it jumps to that $1,000 a month range. So what are some other things to consider when we're talking about affordability? Because monthly premium is, of course, the thing that we face immediately, but there are other things to think about. For example, deductibles. Most large employer plans are set up in a fashion where you have a prearranged copayment when you go to a doctor or a lab or a pharmacy. And if there's a deductible, the deductible applies to bigger ticket items such as hospitalizations. Deductibles work the same that you may be more familiar with on auto insurance policies, where you have to pay the first so many dollars of a bill. With personal policies, it's very common for deductibles to be very large and to be all-encompassing, meaning every trip to the doctor, hospital, lab, pharmacy, you pay everything yourself as it chips away at a deductible. I mentioned that example in Delaware of a 60-year-old paying $1,000 a month in the monthly premium. That came with a policy that had a deductible of just under $7,000 for the year. So when you're budgeting, you need to be prepared not only for the monthly payment, but also that potential $7,000 out of your pocket if you were to experience a major health event. In addition to deductibles, there's a concept called coinsurance. Coinsurance is when the insurance company pays a portion of the bill and you pay a portion of the bill. A very common example there is 80-20, where the insurance company pays 80% of the bill and you're still responsible for 20%. In those instances, your 20% will have a worst case scenario called an out-of-pocket maximum. When you're evaluating insurance plans, it's important to take that out-of-pocket maximum into consideration as well, so that you're prepared if you were to experience that major health event. Now, another consideration to affordability is networks. Networks are where your insurance works. You may have a physician that you want to go to who doesn't participate with a particular insurance plan. When they don't participate with the plan, that's more money out of pocket as well, unless you were to consider changing doctors. So when shopping, you should also consider the network of the insurance company to make sure the network is inclusive of any providers who are important to you. And lastly, in the affordability considerations is governmental assistance. In the era of healthcare reform that a lot of folks refer to as Obamacare, there is governmental assistance available for folks when you purchase health insurance on your own and you purchase it through something called the marketplace. This is the infamous healthcare.gov. When you go to purchase on the marketplace, the government evaluates your estimated annual income, which in theory in retired years may go down. If it goes down below 400% of the federal poverty level, you may be eligible for governmental assistance, which would reduce the cost of the plan. So that 60-year-old buying that $1,000 a month policy, if that person qualifies for governmental help, they may pay something less than the $1,000 because the federal government may be paying a portion of it on your behalf. So when folks come to us and they look at these prices and high deductibles of personal plans, the most common question we face there is, are there any other options? Well, often when you're retiring or leaving a large employer, Cobra could be an option. Cobra is simply a continuation of your identical benefits that you had as an employee, but rather than the employer paying a portion of the cost and you paying a portion, you pay the whole cost. So when I mentioned that average was $500 for several large employers in our area, $500 is what the Cobra would cost in that situation. And Cobra is not always a factor based on your age, but rather a factor based on that employer. So the larger the employer, the bigger the negotiating power in general, and the better the price. So if you have access to Cobra, that very well may be a better buy than a personal plan. But Cobra has time restraints. It can only last for a certain period of time, usually 18 months. So you buy it on a month-to-month basis. If it runs out and you're not yet 65, then you would still need to purchase a personal plan at that point. Now, I mentioned the Affordable Care Act, which was Obamacare. There are plans that are compliant with the law, and that $1,000 example would be one of them. But there are also plans that are not compliant with the law. They cover less things. And sometimes folks may say, you know what, I've got a short window of time that I need to plan for. I don't mind having a less compliant plan in order to achieve a lower premium. So we would need to consider what isn't covered under those plans, and are you comfortable with that risk? And that's the question of, do the costs outweigh the benefits? So now let's talk briefly about the world of post-Medicare. So again, Medicare for most individuals starts at the age of 65, and we would then be considering what options do we have. Is Medicare by itself sufficient? And the answer to that is no. I mentioned earlier the concept of coinsurance. Medicare also has coinsurance, but unlike private insurance plans, Medicare does not limit your exposure with the coinsurance. So if there's an item where Medicare pays 80% of the bill, you would pay the other 20%, regardless of how large that 20% became. So you have a $1 million event, you're at 20% of the $1 million if you had Medicare all by itself. So most folks in the world of Medicare have some other coverage to complement their Medicare. And if you're fortunate and your employer provides a retiree plan, then the retiree plan may complement Medicare. But more often the case, folks need to purchase something out on their own. And there are 3 different types of private plans that you can buy when you're in the world of Medicare. One of them is Medicare Advantage, one is Medicare Supplement, and one is Medicare Part D, which is prescription coverage. So I want to spend a quick moment talking about each of the 3. Medicare Advantage plans are technically referred to as Part C, as in Charlie, of Medicare. Medicare, everything is lettered. I like to call it the alphabet soup of Medicare. Part A is the inpatient hospitalization part of Medicare, and for most folks, that's no charge. Part B, as in boy, is the outpatient component of Medicare, which often folks think about that as the doctor coverage of Medicare, but it's really more than that. It's outpatient labs and physical therapy, other outpatient services. And that part the government charges for. The approximate charge for Part B is $134. However, the government will charge you more if they deem you to be in a high-income household. They look back 2 years. So your first year in the retirement, they're really looking back 2 years ago when you were still earning at your full-time employment, let's say. And if that's a high-income household, you will pay more for your Medicare Part B, as in boy. It can go as high as roughly $500 per month, up from the $134. And it's scaled. The further past this high-income household threshold, the bigger the amount. And that threshold, by the way, starts at a person earning $85,000 a year. As income goes down in retired years, it will adjust, but it always looks at the tax return from 2 years prior. So we got Medicare A for hospital, B for outpatient. B has a monthly charge. If we went with Medicare Advantage, it's technically Part C, as in Charlie. And Medicare Advantage plans often include prescription drug coverage, which is Part D, as in David. So when you sign up for a Medicare Advantage plan that has prescription coverage, you technically have A, B, C, and D. There's a monthly charge that you would pay to an insurance company, and the Advantage plan takes over as your insurance. And it often has prearranged co-payments at the docs, hospitals, and labs. The monthly premiums for Medicare Advantage plans are typically low. Sometimes they're even no monthly charge, but the charge that you pay for Medicare basically goes to the Medicare Advantage company. And when you sign up for a Medicare Advantage plan, you're agreeing to go to that insurance company's network of medical providers. When you sign up for a Medicare supplemental plan, it becomes secondary coverage to Medicare. So when you go to doctors, hospitals, and labs, you show your Medicare card, Medicare pays their portion as the primary coverage, and the supplemental plan will pay a portion or all of the balance. There's different Medicare supplement plans, and they're also lettered in that alphabet soup that I mentioned. And the price depends on how comprehensive the plan becomes. But Medicare supplemental plans do not cover prescription drugs. So folks who purchase a Medicare supplemental plan also need a prescription drug plan, which is referred to as Part D, as in David, and there's a monthly charge for those things too. So just some averages. Medicare Part B, as in boy, average cost $134 a month per person. Medicare Advantage plans oftentimes have no monthly charge. Medicare supplemental plans, average price for a 65-year-old in Delaware for a very comprehensive plan is about $150 a month. And the average cost of a Part D prescription drug plan is average $40 a month. So if you said, hey, what's my total look like if I wanted to have Medicare, a good supplemental plan, and a drug plan, grand total there is going to be roughly $300, assuming that you don't have the high income household surcharge. So I know I went through a lot of things quickly, but we wanted to pause there while we still had a few moments left together this afternoon to see if anyone had any questions.
Hey, Nick, that was really insightful. Thank you as always. As Nick said, is there any specific questions that anyone has? If so, please type them in now. We'll give you a minute. Otherwise, we can get in touch with Nick and his team if you have questions later. They've always been a great friend of Diversified and willing to answer questions and or assist where they can.
We just put up the consumer website and phone number as well if you needed to reach us. And whether you work with us or someone else, what I would suggest is when you're thinking about moving into retirement or for whatever reason have a need to purchase private health plans, I'll mention that when you work with insurance agents and brokers, there's no charge to you for our services. The insurance companies pay us to do what we do, and they all pay us roughly the same. So we don't have an incentive to push one insurance company over another. So it's always a good idea to have a second set of eyes and a professional taking a look to help you. So many times when we've worked with Diversified's clients, they've come to us and said, you know, I do have access to this DuPont retiree plan or this Seneca retiree plan. What do you think? And we don't mind providing our 2 cents worth. And often that results in us saying, you know, what you have is pretty good. You don't really need to purchase out on your own in the private world. So we don't mind doing that as well.
Okay, great. Okay, well, it seems like no specific questions. Actually, we do have one. Can you appeal the high income categorization? Sorry.
Yeah. Yes. So oftentimes folks will tell us, you know what, I was in that high income scenario 2 years ago, but I'm not right now. And I'm facing this surcharge. Is there anything I can do? Well, first thing is, if you do nothing, the surcharge will automatically ratchet down, but it waits each year until tax return is filed, and then it's looking, 2 years back. You can appeal immediately, and the best way to do that is to visit your local Social Security office. Our experience tells us that when calling Social Security versus showing up in person, you tend to have more tenured folks at the physical locations than the call centers. And so you can visit the local Social Security office and appeal the high income surcharge. If nothing else, it'll at least speed up the process of when it ratchets down rather than waiting for the tax return. So they may not say, okay, your appeal is approved this year and we lower it right away, but we see that your income's gone down. We'll already note the system, and the change will happen at the beginning of next year or at the beginning of 2 years from now. So it's never a bad idea to appeal, particularly if you know income has dipped below the magic line, or will be dipping below the magic line. And again, that was $85,000 on a single person, $170,000 on a household.
Okay, and so follow-up to that is, in that situation, if one person is retired and the spouse is not, would it be better to file taxes separately?
Mm-hmm. So they do go based off tax returns. So if you file a joint return, they're going to be looking at the joint amount. If you do file separate returns, they will consider the separate returns as well. So if you have that situation you just described with one spouse retiring, income going down, other spouse return still working, you'd have to weigh the pros and cons of the joint tax return savings versus the potential savings in the high income surcharge by filing separately. So not a real right or wrong answer there, but multi things to consider.
Right, and we certainly, us with Nick and his team's help and our tax experts' help, we can help work through that if anyone would like. Here's a two-part question for you, Nick. When does it make sense to apply for Medicare if I plan to work beyond 65? And do I need to apply for Social Security at the same time?
Great questions. So Social Security and Medicare are two separate items. You can have one without the other, but Social Security is the billing arm of Medicare. So if you are receiving Social Security income and reach Medicare age, you'll be automatically signed up for Medicare, and Social Security will start to deduct the monthly charge for Part B from your Social Security income. So if you're receiving Social Security income and don't want Medicare for any reason, you have to proactively contact Social Security and tell them not to enroll you. Conversely, if you want Medicare and you're not yet receiving Social Security, you have to actively sign up for Medicare, which you can do online relatively easy at medicare.gov or by calling Medicare at 1-800-MEDICARE or visiting the local Social Security office. But to the other part of that question is, if I plan on working past the age of 65, do I need to sign up for Medicare? And the answer there is, it depends. Some employers offer health coverage that Medicare considers to be creditable coverage. And they send a notice to you every fall that says, the plan is creditable coverage for Medicare. And if you're not sure if your plan is creditable coverage, if you work at an employer large enough with HR, you'll want to contact the HR to check. If you're still working and the plan is creditable coverage and the employer has 20 or more employees, then you can say, I don't want Medicare right now, I'll sign up when I retire. And your retirement is a qualifying event to sign up for Medicare right then and there. But I mentioned a lot of caveats there. Got to be creditable coverage, got to be an employer more than 20 or more employees. Let's say you were working for a small employer and or the employer didn't have creditable coverage. You have to get Medicare when you turn 65. Otherwise, there's only certain moments in time that you can sign up later, and you'll be charged a surcharge for not signing up when you were first eligible. So you don't want to face the surcharge because the surcharge lasts the rest of your life. So if you're still working past 65, just make sure that the company has more than 20 or more people and also creditable coverage.
Right. Thank you, Nick. It seems like that is our questions for today, and we're just about out of time. Again, thank you as always, Nick. You're a friend and a great resource for us and all our clients. Again, we will be emailing this out to everyone. So if your notes weren't keeping notes fast enough, we will send this out with the presentation and recording. And please make a note, June 13th at noon. The essential estate planning documents that everyone needs will be our next webinar. Thank you, Nick. Thanks, everyone.
Thank you
for your coming and joining, and have a great day.
Appreciate it. Thank you.